So let's get an update on the Princess of Wales, recovering in hospital, of course, this morning after planned abdominal surgery. Well, it's on many of the front pages this morning, as you would expect, along with the King's announcement that he's also going to have treatment for an enlarged prostate. Not unusual in a man of his age, of course. GMB's Richard Gaisford is at Kensington Palace for us. How are they doing? Because all everybody wants and hopes is that she's OK.
Yeah, well, we've heard that Kate is doing well and that we'll only get updates now from the team here at Kensington Palace as and when there is anything significant. Bit of a shock yesterday to get these two bits of news in quick succession, almost just an hour in between them. It was Kate's first, of course, that we heard that she had been admitted to hospital for that abdominal surgery, that it had been planned. It wasn't an emergency and wasn't cancerous, so all that bit of it was good news. But some concern being expressed by many that she could be in hospital, Lorraine, for between 10 and 14 days. That is quite a lengthy period of time to be in the hospital itself, and then to have up to 3 months of recuperation, which means she is really out of the picture in terms of the royal schedule until at least Easter. Prince William also stepping back from royal duties over the next few weeks. He is going to be looking after Kate, looking after the children, taking a very modern royal approach. His father, King Charles, is up in Scotland. That's where he got his diagnosis for the enlarged prostate, and wanting to share that information with as many people as possible, because this is a condition that affects so many men over the age of 50, almost 1 in 3 of them. He will be getting treatment, we're told, at some point next week. Not clear yet, Lorraine, whether he'll stay in Scotland for that or come back down here to London.
Sure. Thank you, Richard. Thank you. As we said, as long as she's all right. Dr Hilary's here. As Richard was saying there, it's quite a long period of recovery in hospital, and then when she gets out of hospital, she's going to be out of action for quite some months. So clearly, although it's planned, it is something pretty serious.
It's unusual for a relatively young woman to be in hospital that long and to have such a long recuperation period. So obviously that's going to fuel speculation. A little bit rude to talk about what it could possibly be.
No, I don't, and I don't think we should.
No, I don't think we should.
I think if she wants us to know, then fine. Really, I think all we're bothered about is that she's all right, and
Absolutely.
It sounds like she is,
Yeah.
which is great. So
she's in the right place.
Exactly,
Yeah.
she's getting taken care of. Prince Charles. King Charles.
King Charles.
I still say Prince Charles. It's funny,
Easy
isn't
to
it?
do.
It has taken us you think by now, it's been over a year, but still. King Charles. This actually is really good that he is telling everybody, because it does mean it can happen to anybody.
Of course it can.
And people shouldn't be worried about it, or they shouldn't be embarrassed.
It'll happen to every man on the planet as they get older. So gradually, probably 60% of men over 60, 70 will have benign enlargement of the prostate. So this is a common condition. It's good that he's talking about it. It raises awareness. It encourages men to come forward if they've got symptoms of urinary problems. And some of them, when they're investigated, will turn out, 1 in 10 will turn out to have prostate cancer. So it will save lives, him doing this.
Get it early.
And it's really good. It's nothing to be ashamed of. No stigma anymore, no taboo anymore. So I'm really pleased he's done this.
No, me too. Good for him. I hope he's going to be OK. We will see you later.
You will.
We will see you later. Yeah, and we just wish them both all the best.
Hear, hear.